Hello everybody, my name is Mike Urquhart and I'm an exercise physiologist with TMC Cardiac Rehab. Today I'm here to show you some resistance training exercises. These exercises are used to rebuild muscle or to increase your strength before, during, and after any sort of cardiac procedure. It's really basic weight training and you can do these anywhere and at any time. So without further ado, let's go ahead and get started. So these exercises can be done almost anywhere. And I'm going to grab some free weights that I actually have on hand. If you don't have free weights, you can use anything that will provide any sort of resistance, like a milk carton, a water bottle, almost anything like that. But I have free weights. Now, our first exercise that we're going to do is called the shoulder raise exercise. And all we're going to do is extend our arms straight out, just like that, and then down, up and down. You really want to contract fully on the way up, and you want to recover gently on the way down, up and down. Now I get asked a lot of times, Mike, what sort of weight should I start off with? And how many reps should I do? Well, the first answer is the amount of reps that you should do should be anywhere between 12 and 15 repetitions. The answer to the second question is, well, if you're new to this exercise, err on the light side. So start off with the lightest weight that you can possibly stand that will get you to 15 repetitions. So once again, we'll continue. 3, 4, 5, 6, contract going up, 7, and control going down. 9, 10, 11, 12, 13, 14, and 15. Some alternate ways to do this exercise is you can do one arm at a time. 1, 2, 3. And obviously, if you're going to do them individually, you just double the amount of reps that you're doing. So we would go up to, if we're doing 15 reps for both arms, you would just do 30 reps if you're doing them opposite each other. That will actually help with balance, and it will actually help with the fluidity of the exercise as well. Our next exercise is called the shoulder press. Now, another question that I get asked is, do you have to use the same weight for every exercise? The answer is no, you do not. You can always lighten up or vary the weights that you do use for the different exercises. The next exercise is called the shoulder press. Your arms start here with your upper arms parallel to the floor. And then all you do is just press straight overhead. 1, 2, 3, 4, 5, 6, 7, 8. Notice how my upper arm comes down parallel to the floor and then back up again. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Excellent. And relax. Now, between each exercise that you do, or if you're going to do multiple sets, rest somewhere about a minute between each set or between each exercise. And that will give your arms, it'll give your body a chance to recover. The next exercise is called the bicep curl. It is a very basic exercise, but it's one that I see people do incorrectly most often. And really all you're doing is just engaging your bicep. And it looks like this. 1, 2, 3, 4, 5. When you are contracting your bicep, do so at the top of the exercise. Really contract that bicep. And on the recovery, make sure your arm is nice and straight. 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. And once again, you can do these, you can alternate each arm as well with that exercise. So your right, then your left. Okay? Very simple exercise, but probably the one that I see people do incorrectly most often. Now the next exercise is for your triceps. And this particular exercise I call the tricep overhead extension. And what you're going to do with this exercise is you're going to take your weight or your resistance, and you're going to hold it up behind your head. And when you engage the exercise, you're going to reach up over your head. If you think about it, it's almost like if you're in a hammer throwing contest, like you're throwing a hammer. You're really engaging your tricep on that extension. I'm not sure how many reps I've done, but let's start with 6, 7, 8, 9, 10. Keep your elbows stationary. 11, 12, 13, 14, and 15. Excellent. And recover. That was the tricep extension, overhead tricep extension. Our next exercise, I call this the I don't know exercise, or more officially known as the shoulder shrug. And the reason why I call it the I don't know exercise is because the motion is, it's a little hard to define. But if you say I don't know, people get it. And it's a shoulder shrug, the I don't know exercise. Bring your shoulders up to your ears and then down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Excellent. And those are just some basic resistance exercises that you can do anywhere, anytime to help build your strength. Thank you for watching. Hi, and now I'm going to show you some exercises that are a little bit alternative to the ones that I just showed you. And we'll utilize a chair. All of those previous exercises that I showed you can be done in a chair. So, for instance, the shoulder raise, just taken out right by your side. And then we'll go from that and I'll show you the shoulder press. Just press straight overhead. And now the bicep curl. Arms by your side, really engage your bicep. And the tricep extension, overhead extension, just straight up. And then the last one, the shoulder shrug. Some other alternative exercises. Can include a stretch band. Stretch bands are very handy, they're very lightweight. They can be purchased at almost any department store. And a lot of the exercises that we just did can be performed with stretch bands. The first one, the shoulder raise, just straight out. These stretch bands, they come in different colors, and the different colors represent different resistances of the band. Another alternative to the shoulder raise is the side shoulder raise. Just bring your arms out to the side as well. And like I said before, you can always alternate, just like that. And then one of my favorites to do with the stretch band is the bicep curl. And then, of course, one of my other favorite exercises, the shoulder shrug. And the stretch band is providing all the resistance that you need. Once again, thank you for watching.